To our first episode of the Compas Teach. Today we're going to be covering ABG interpretations, and this is part of a series that we're going to be starting, and our whole goal with this is to bring you guys some information, some free resources and study tips. The Compas and I really struggled with some of these subjects, and we didn't really have people around us that understood them and that could properly explain it to us in a way that made sense. And we just want to help you guys out with that. Before you actually start analyzing an ABG, where you need to cover the three main components of an ABG, and that's important that we know the range of these numbers or the range of these values, just because, like with any exam that you're trying to see what's off, you always want to know your baseline. So our first value that we're going to have is a pH, and so the pH is basically the balance that our body's trying to maintain in order to secure or regulate hemostasis, which is where our body is optimally designed to function. So our range for that is coming in right here at 7.35 to 7.45. So outside of that, if we're higher than 7.45, we're alkalotic, and if we're below 7.35, we're acidotic. One of the two components that regulate our pH is going to be CO2, so that's coming from our lungs. So this is why we highlighted this blue, and our range for that is 35 to 45, and as you can see, it's kind of similar to our pH, so it should be pretty simple to kind of memorize that. So when we're looking at our range, if we're higher than 45, we're going to be acidotic. And why is that? Well, CO2 is slightly acidotic. So if we're retaining CO2, we're increasing the level of acids in our body, which is actually going to decrease our pH. But we'll get more into that later on. And looking right here on our lower end, if we're losing our CO2 or we're blowing it off, we're becoming alkalotic. So anything below 35, we're going to be alkalotic. Then moving on to our bicarb, we have this highlighted in yellow, because it's excreted by the renal system primarily, and that just reminds me of pee, so we highlight that yellow just to keep our notes kind of intact. And our range here is 23 to 27, and if we're above 27, we're alkalotic, and we're below 23, we're acidotic. So our normal range values, we can actually dive into the process of naming our ABG. And so this process is set up into two different steps, and we're basically going to come up with a name for a baby, or ABG, that has a first name, a middle name, and a last name. And we're going to do this by first analyzing our pH, and we're going to give it a first name and a last name. And then once we do that, we're going to look at the body system, which is going to be either the CO2 or the bicarb, to determine, and we're going to name it. And based on that, we're going to determine who is responsible. If we look at the choices here that we have, we can see that it's very limited, which is what makes this system, or this method, extremely straightforward and easy to understand, and even easier to implement. So our first name is limited to two choices, which is going to be uncompensated or compensated, and then our middle name is going to be respiratory or metabolic. And then our last name is going to be either alkalosis or acidosis, which is limited choices, but again, this is going to become very beneficial for us. First step of naming our ABG, we're going to look at our pH, and our pH is going to have two names, and it's either going to have the name compensated or uncompensated as a first name, and then the last name is going to be acidotic or alkalotic. And so if we look at this chart, it looks pretty confusing, and I know a lot of the charts in the textbooks and online are extremely confusing. They have a lot of arrows and different boxes, and once we go over how to come up with this triangle, you're going to see it's pretty simple. So first what we're going to do is we're going to write our 7.35 and then we're going to give it some space, and we're going to write 7.45. And right in the middle, we're going to write compensated. And that's our normal range. And right above that, we're going to put 7.45, which is our middle. Then, if we look at, so we will agree that any value between 7.35 and 7.45 is going to be compensated. And then the values between 7.45 and 7.40 are going to be acidotic, so that's our last name. And any value between 7.4 and 7.45 is going to be alkalotic, and that's the last name for that. And any numbers below 7.35 is going to be uncompensated, the same as if they're above 7.45. How to draw our triangle, we can start using it to name our pH. So as we can see up here, we have our triangle that we just drew, and we're going to review once again our compensated and uncompensated ranges. So our normal range of 7.35 and 7.45 is going to get the first name of compensated, and then any values between 7.35 and 7.40 are going to be acidotic, and the values between 7.4 and 7.45 are going to be alkalotic. So if we can practice right here, in our first example we have a pH of 7.8. So if we look at our chart, 7.8 somewhere right here, so it's a compensated, and then it's below the 7.40, so it's acidotic. So this pH is going to be compensated acidosis. In our next example, we have a pH of 7.43. So we look at our triangle, 7.43 is somewhere over here, and it's going to be compensated because it's still within our range, and it's going to be alkalosis because it's alkalotic. So the name for this pH is going to be compensated alkalosis. Next we have a pH of 7.50. So this one is outside of our range, so it's uncompensated, and it's going to be alkalotic. So now that we know how to name our pH, we can look at a complete ABG and go through and analyze one in its entirety. So here we're going to have a pH of 7.05, which is going to be acidotic, our CO2 of 29, which is going to be alkalotic, and our bicarb of 11. So the first thing I like to do when I get a ABG is, whether it's in my head or actually writing it down, I just write down where these values land. So our pH of 7.05 is acidotic, our CO2 of 29 is alkalotic, and our bicarb of 11 is acidotic. And that's just the first step. I don't try to get too ahead of myself, I just label the things, that way we know what we're looking at. Here we have the same ABG from earlier. As you can see, we labeled it just how I showed you guys. We have our pH of 7.05 and it's acidotic. We have our CO2, which is 29, which is alkalotic, and we have our bicarb, which is acidotic, and then we labeled them, with the blue and the yellow. You guys can decide what colors or which method you want to use for that, but that's just the way I like it. So now we can go on to our first step, which is going to be to name our pH. And our pH, remember, is going to have a first name and a last name. So we have the same chart down here that we used earlier. And if we look at our pH of 7.05, we can see it's way below our 7.35. So that's uncompensated, which we have right here. And it's going to be acidotic because it's below the 7.04. So our pH is uncompensated acidosis, right? So now that we've established the name of our pH, we can move on to step 2, which is look at which system is responsible for us being in a state of uncompensated acidosis. So we have our same ABG. We've established that our pH is an uncompensated acidosis. We look at our CO2, and that's an alkalotic CO2, so it's not that one. And we look at our bicarb of 11, and it's acidotic. So same last name, and that is the father of our baby ABG. So this ABG is an uncompensated metabolic acidosis. And that's basically all that there is to naming your own ABG using this method. So in summary, you want to find the name of your pH. You're going to evaluate it using the little triangle. and then you're going to analyze which system is responsible for putting you in that state. I hope you guys enjoyed this, and I look forward to making more videos for you guys. Feel free to drop off some comments and suggestions below.